Good day. This lecture is called Introduction to Medical Sociology for Biomedical Students. My name is Kailit Phua. I'm a retired professor of public health from the School of Medicine and Health Sciences, Monash University, Malaysia campus. Some of my biographical details. Lecture notes available at this website. Now, learning objectives. Many of you probably have never taken a social science course in your education. So, in this lecture, I hope to help you gain an understanding of sociology as a social science discipline. Now, sociology can be used in the solving of biomedical and public health problems. And I also wish to introduce you to a number of major sociological or epidemiological variables. What is sociology? Sociology is one of the social sciences. Sociologists study human societies, usually in a comparative manner, human behavior in groups, and how individual behavior is shaped by social institutions and socio-economic forces. That is, how the larger society and its processes affect the behavior of individuals through things such as values, norms, and so on. Some examples of social institutions, that's of course the family, very important social institution, school, our religious beliefs, and legal system of the larger society. What is considered legal, what is not legal, what is prohibited, and so on. Historically, sociology developed in association with the challenge of responding to social problems arising from industrialization and urbanization in Western Europe. When the countries of Western Europe industrialized, a lot of social problems, a lot of people in the countryside moved to the cities, they live in poverty, bad housing conditions, overcrowding, etc. And this, of course, affected their health. So one major component associated with industrialization was the movement of people from the countryside, peasants, into cities. So this process is called urbanization. What is medical sociology? Actually, medical sociology, in my opinion, is not a very appropriate term. I would think that something like sociology of health and illness is actually a much better term. Now, it simply refers to using the sociological way of thinking to study or solve biomedical or public health problems. Medical sociologists usually approach the subject from two angles. One is called sociology of medicine, and the other one is called sociology in medicine. Now, what do we mean by these two things? Sociology of medicine is usually more theoretical, emphasizes concepts and so on. One famous example would be the famous book by American sociologist Elliot Fritzson called Professional Dominance. That is a study of why and how doctors became dominant in the health professions and in health institutions. Another example would be sociologist Paul Starr's book called The Social Transformation of American Medicine, which predicted the erosion of this dominance with the rise of corporate medicine, for-profit medical care provided by corporations, by companies. Then there's sociology in medicine, which is more directly applicable to clinical sciences and public health and so on. This approach focuses on applications and solving problems using sociological knowledge. So an example would be David Mechanic's studies of illness behavior. That is, when do people recognize signs and symptoms as something being out of the ordinary, abnormal, unusual, and they interpret this as being sick, being ill, and then they decide where to seek help. Should they go to a medical doctor? Should they go to a traditional healer? Should they go to alternative practitioners? Another example with studies of adherence, also known as compliance, that is whether a patient follows the advice, the medical advice of clinicians, whether to take the medicine properly or not, correct dose, correct dosage, correct time, etc., etc. Now, these are some major sociological concepts which are useful to biomedical students. Now, this is how you think sociologically, how you think like a sociologist, right? First one is called ethnicity, oftentimes called race, class or social class, gender, so-called sex, age, region, geographical location where the person resides or works, and so on. Education, referring to educational attainment, the level of educational achievement reached by a particular person, whether primary school level, secondary school level, that is high school level, or tertiary level, a bachelor's degree, master's degree, PhD, and so on. Marital status, whether somebody is married or single or divorced or separated or widowed or whatever. Then, of course, religion. And there are other sociological concepts also. Example, sexuality or sexual orientation, where somebody is heterosexual or homosexual or bisexual and so on. Ethnicity. How does ethnicity or race affect a person's health? Now, how does membership in a particular ethnic group affect one's health? For example, the health of indigenous peoples and ethnic minorities. We know that in many countries, indigenous peoples and ethnic minorities tend to have a poorer health than the majority, all sorts of reasons, discrimination in terms of housing, in terms of occupation, and so on. All right, how do you measure health at the population level? In contrast to the individual level, where you take things such as blood pressure, cholesterol level, and so on. At the population level, we measure health through morbidity rates, morbidity or sickness rates, disability rates, mortality or death rates, and life expectancy, usually or commonly life expectancy at birth. Then we also want to see how the culture which a person grows up in affects health-related behavior, and in terms the chance of getting various diseases. So, for example, nutritional patterns. We know that nowadays in certain countries, people are getting obesity rates are increasing, and this can be attributable to some extent to unhealthy foods, fast foods, and so on. Other kinds of health-related behavior affected by culture, right? For example, whether people, when they have health problems, especially mental health problems, whether they go to see a psychiatrist or whether they go to the spirit medium or traditional healers and so on. There's also something called culture-bound illnesses, that is, illnesses which are found in some cultures or not in others. For example, one example would be anorexia nervosa, which is unheard of in some countries where people are so poor, they don't even have enough to eat, they are malnourished and so on. We know that anorexia nervosa is actually a a psychiatric problem, and it's actually not easy to treat. People who have anorexia nervosa perceive themselves as being overweight, and they do all sorts of things to try to lose weight. They skip meals. And then of course there's something related called bulimia, where people eat and then they make themselves vomit. Social class and health. We know that social class of people affect their likelihood of health or illness. This is also called the social class gradient in health, which refers to people in the lower classes tend to have poorer health than people in the upper classes. Michael Marmot, famous doctor as well as public health researcher, conducted a series of studies called the Whitehall studies. Whitehall meaning referring to the British civil service. Whitehall of British civil servants who are by no means poor. They're all civil servants, but they're of different grades from the lowest to the highest. And he and his researchers documented the existence of a health gradient by civil service rank. That is, the higher the civil service rank of the individual, the better the health compared to those in the lower civil service ranks. Now, note that sometimes SES, or socioeconomic status, is used instead of the term class. Gender and health. Now, sociologists differentiate between gender and biological sex. Biological sex is whether we have born with X and Y, XY chromosome or XX chromosome, and whether biologically we are male or female. Gender is how we are socialized to behave in certain ways, behave in masculine ways, feminine ways, and so on. And this can differ. Behavior is acceptable for one gender or not acceptable can differ by different societies. So we want to see how gender and socialization affect health. So for example, cancer of the cervix is related to biological sex simply because biological women have cervix and biological men do not. Now, lung cancer, we know a lot of it is due to smoking of tobacco, and usually males tend to smoke at higher rates than females in many countries. Substance abuse, which gender, right, is more likely to smoke, which gender is more likely to drink alcohol heavily, to take illicit drugs, and so on. Now, sexually transmitted infections, or STIs, example, HIV/AIDS, again related to sexual behavior, which is linked to gender too. Injuries and risk-taking behavior. So males typically engage in more high-risk sports and accordingly suffer higher rates of injuries. Body image and eating disorders. Now there's a link to gender and eating disorders. Typically females tend to suffer from higher rates of eating disorders such as anorexia nervosa or bulimia nervosa compared to men, and this is due to socialization. Age and health, we know that the life cycle of an individual can affect the chances of developing particular illnesses or diseases and so on. So the life cycle, before birth, as a fetus, and then after birth, you're an infant, then become a child, then teenager, young adulthood, middle adulthood, and old age. So typically, for teenagers and young adults, the chances of dying from disease is relatively low, and teenagers and young adults typically at higher risk of suicide and road traffic injuries. Region and health, geographical location and health. Do people live in rural areas, urban areas? Do they live in urban slums, or do they live in desirable high-income areas? Do the people come from poor country, or come from a rich country, and what are the physical characteristics and weather of a region. So in the early days of industrialization in Europe, urban health was much worse than rural health because people were living on it in the slums and bad working conditions and so on, right? Okay, physical characteristics, weather of a region. Now we know that with climate change, so-called global warming, certain areas of the world are experiencing stronger or more intense disasters brought about by such things as typhoons or hurricanes and cyclones and so on. So, for example, people living in the Philippines or in the Caribbean, higher risk of suffering injuries and deaths from typhoons and hurricanes. Education and health. There is a link between educational level and health. Typically, less educated people tend to have poorer health than better educated people. Better educated people are more aware of healthy lifestyles, exercising. They are better able to afford nutritious foods, live in good quality housing, etc. And researchers have also found out that female education is associated with lower infant mortality rate or deaths of infants under 1 year of age. So for example, if the mother has basic education, primary education, the chances of her infant dying before the age of 1 is lower, right, than those with no education or very little education. Marital status and health, right? As I mentioned earlier, marital status refers to whether a person is single or married or divorced or separated from the spouse, widowed, and so on. Marriage is usually good for a person's mental health for most people. Of course, if somebody is trapped in an abusive marriage, then of course a different story altogether. People living alone, single people, the widowed, elderly living by themselves tend to have poorer health. Religion and health. We know that religious values affect health-related behavior, which in turn affects health. So for example, religious beliefs can affect what people eat, diet, right? Some religions, people, the devotees follow vegetarian diet, right? Smoking, drinking, for example, in Islam, drinking alcohol is haram, right, or forbidden. So we would expect that in Muslim majority countries, health conditions related to alcohol abuse would tend to be at lower rates. Sexuality, right? So people's sexual behavior can be affected by the religious beliefs. Seeing the doctor, including a psychiatrist, and seeking medical care, for example, among the Christian denomination known as Jehovah's Witness, the devotees typically want to avoid having blood transfusions, right? So in that case, if somebody who's a follower of Jehovah's Witness gets into a situation where there's heavy bleeding and so on, then that would be a difficult situation in terms of what the healthcare provider can do, right? So if the healthcare provider wants to respect the person's religious beliefs. Now, in medical sociology, there are also other concepts, right? Some are more advanced. What I mentioned earlier are the typical sociological variables. Now we have some more advanced concepts. One is called medicalization, and the other one is called demedicalization. Medicalization simply means what used to be a social problem gets redefined as a medical problem to be treated by doctors and other healthcare professionals. Example, alcoholism used to be seen as a moral failing of an individual. Nowadays more and more seen as an addiction, a health condition which can be treated. Domestic violence, So again, more and more perceived as a problem which can be handled or which can be assisted through help from mental health workers, compulsive gambling or gambling addiction, right? So again, can be seen as a mental health problem rather than an individual failing. Now there's also demedicalization. An example would be homosexuality, which is no longer classified as a mental disorder by the American Psychiatric Association from the early 1970s onwards. Thank you for listening. So this basically is a short introduction to medical sociology and is aimed at medical students and other biomedical students. Thank you. Bye.